All right, so we're about to cover body movements, and I introduced this in lecture because so many students struggle with it in lab. So I figure it can't hurt to hear it first in lecture, and that way when you're in lab, it's not going to be the first time you've heard this information. In lab, for the second lab unit, you'll not only be required to learn most of the superficial muscles of the body, you'll also need to know their primary movements. So you need to know what those movement names mean. For example, knowing that the gluteus maximus, the big muscle in your butt, helps you to extend the thigh doesn't mean too much to you if you don't know what extension of the thigh means. So let's go over the major body movements. Okay, flexion and extension are opposing movements. When you flex, you move out of anatomical position. When you extend, you return back to anatomical position. These are anterior-posterior movements, meaning they're along the sagittal plane, so forward, backward movements. Some joints can hyperextend. Remember, extension is when you return back to anatomical position, and some joints allow you to continue moving beyond anatomical position. That's called hyperextension. Some joints, like say your elbow or your knee, do not allow for hyperextension. Okay, on the right, the blonde woman is doing flexion of her vertebrae. So she's curling her back forward and flexing her vertebrae. And let's look at the diagram to the left. Part A, that man is flexing his arm and extending his arm. Part B, he is flexing his head forward and then extending his head back, and then hyperextending the head where he's looking kind of up at the ceiling. The woman in part C is flexing her hips. Notice her back is straight. She's not flexing her vertebrae, she's flexing her hips. And then she's extending her hips, and she's even hyperextending a bit. She's going beyond anatomical position. Okay, the woman on the left is flexing the arms, and then right next to that, in the middle, she is hyperextending her arms. So she not only returned back to anatomical position, she went beyond that. The woman on the right in blue is flexing the forearm and then extending. The forearm cannot hyperextend. The elbow does not allow for hyperextension. Abduction and adduction are lateral medial movements, meaning they're in the frontal plane. The way I think of these is I think about snow angels, kind of moving your arms and your lower limbs out to the side, out laterally and medially. Abduction is when you move a limb away from the body. Adduction is when you move it towards the body. And those names make sense. Abduct means to take away, and adduct means to go towards or add. So look at part A. That woman is abducting her arms by bringing them away from the body. And then in part B, she is bringing her limbs back to her body, or adducting them. Technically, it's also possible to abduct and adduct your phalanges, your digits. So look at the upper right-hand corner. You can see what abduction of the digits looks like and what adduction looks like. Elevation and depression is when you bring a body part up and down. So elevate is to bring it up in a superior fashion. Depression is to bring it back down or inferiorly. We can see those gentlemen there are elevating and depressing the scapulae. You can also elevate and depress your ribs. Anytime you inhale, you elevate your ribs. Anytime you exhale, you depress your ribs. Protraction and retraction. This means to move a bone anteriorly or forward is to protract, and to move a bone back or posteriorly is to retract. You'll see these gentlemen here are protracting and retracting the mandible. You can do the same with your scapulae. So if you curl your shoulders forward, that would be protraction of the scapulae. If you bring your shoulders back, like when you stick out your chest, that is retraction of the scapulae. Rotation and circumduction are not opposites. However, they are movements that students confuse or mix up, so that's why I've grouped them together here. Rotation is to spin on an axis. Like you can see in the upper right corner, that person is spinning their toes out away from their body. That would be lateral rotation. And bringing the toes back forward would be medial rotation. So we're spinning on an axis. Circumduction is not spinning on an axis. That's when you move a body part such that you outline an imaginary cone or circle in the air. Rotation, remember, is spinning on an axis. It can be medial or lateral. So for example, look at the woman in the center of the image. She is moving her face away. That would be lateral rotation, and then moving her face back to center would be medial rotation. In the upper right-hand corner, you can see that man is doing lateral rotation of his arm and then medial rotation of the arm. Same thing down at the bottom of the screen, medial and lateral rotation of the arm. Supination and pronation are a form of rotation, and they're specific to the forearm. Supination is when you rotate your forearm such that the palms face forward, or you can bend at the elbow, so with supination the palms would face up. Pronation is when you rotate the forearm such that the palms face back or posteriorly, or if you have your elbow flexed, it's when your palms face down to the ground. Inversion and eversion are terms only used for the ankle. Inversion is when you lift up the inside edge or medial edge of your foot. Eversion is when you lift up the lateral edge of the foot. So D at the bottom of the screen would be inversion, and E would be eversion. These movements are important for balancing. So for example, sports like ice skating or roller skating or skiing or snowboarding, you do a lot of inversion and eversion in order to not fall off of whatever it is you're on. Opposition and reposition is specific to saddle joints. This is unique. There's only us humans and a couple of other mammals that can do this. And opposition is when you can take your distal phalanx of your thumb and meet it up with the distal phalanx of another digit. Opposable thumbs, so to speak. When you bring the two tips together, that's called opposition. When you return back to anatomical position, that is referred to as reposition. And again, it's thanks to that saddle joint in our thumb. Allows for awesome tool usage in us humans. Really gives us a huge evolutionary advantage over other mammals. Dorsiflexion and plantar flexion are movements at the ankle, such that you move your toes down or up. Plantar flexion is to move your toes down, like when you're standing on tiptoe. Dorsiflexion is to move your toes up, like when you stand on your heels.